Okay, Osha Fudge. I'm your biggest fan. Okay, Osha Fudge. Osha, occupational safety and hazards. Okay, I'm your biggest fan. Hype, hype. Okay, hype, hype. Okay. It's glad I'm not alone. All right, so I know I always hate this little awkward part, but it's like, let's wait for a few more people to come on. I'm totally happy at least that part works. So we could do a little chit chat and I'll edit this part out before we start. Um, okay, I like that. Osha Fudge, or nurse. Yeah, I'm trying to figure out. I like the mask. Blow me a kiss. Hey, we're losing people. We just started. I'm doing this on my webcam. Just trying to really get a good handle of this YouTube bit before I start. But I am totally happy that it worked. Before I go buy some expensive. So my number one fan, Osha Fudge. Can you hear me? Okay. Unless you're like a bot. Nothing. Mike is good. I like that. I like that. Good. Yeah, I have a few things. I mean, it's like, I'm trying to get some natural lighting. So I always try to sit by the window, but then it's just total glare. So I have a light up here, ring light. It's just, you got to do it. You got to do it right. So somebody else came on. Who's that? Come on, tell me who you are. Don't be a stranger. Um, I'm not a bot. That was a compliment, actually. That was when they think you're a bot, compliment. That means you got it. We got it like that. Yeah. So honestly, so I'll repeat this as a few more people come on. I have this channel. The students asked me to do this channel. Should have done this like years ago. It would have been like rolling in the YouTube dough. But anyway, so my purpose of actually doing this channel was really just for something like this, where if I have some time, and I'd like to maybe do this live once a week. I think students, would like that. Once a week. I thought Fridays would be good. I mean, pre-corona. I mean, where exactly are you guys going on a Friday night? Down the stairs to the refrigerator. But, leave your weekends, your pre-weekend turning up to yourself. So I just figure maybe I would just start to do this on a Thursday, and then, based on what else happened, we'll get it together. Okay, so I see a few more people. Why don't you just type something in the chat box so I could know who you are? Somebody. It's pretty warm. And see what's going on. Cats got their tongue. Well, Osha Fudge, it's just you and me. Are you ready for your nursing exam? Ready or not? Here it comes. Well, let's start. And, if we have to repeat, if a few more people, so three's company, so I think it's fine. So let's see. I am just a middle schooler. Ah, excellent. What do you mean just a middle schooler? That's awesome. but I do not do nursing. So, but what do you want to do? What do you want to do, middle schooler? What exactly do you want to do when you get to high school and beyond? Change the world, I hope. I'm gonna have to go check out your channel and see. What do you have over there? Let's go see. Love that I have my phone. Yes, that's good. Do you know anybody that does nursing? Oh, let's see. Maybe I'll be a nurse. Maybe I won't. Maybe maybe you can do a lot of stuff. Maybe I'll convince you to either stay, or maybe I'll convince you to stay or not. Well, that's the good thing about life. You do have choices, and you can change your mind. You can totally change your mind. I didn't set out to be a nurse, and here I am. I'm an educator and trying to get people to fully get there. But Well, so I'm going to give you a special welcome because I usually start my channel this way. So, Osha Fudge, I'll give you a special. So, ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. In this video, and that's usually how I start every video, and hopefully you stay at the end. I usually have a little greeting for those who just came on. So I think the other two people, one person is being very, very shy. So maybe you'll be a nurse, maybe you won't. You don't have any ideas outside of nursing? You're thinking of anything? You're swaying someplace? Your family's pushing you to something? You know how that goes. Oh, let's see. Maybe being a teacher or writer. Okay, excellent. Hey, McLaren. Yes. Okay, good. There you go, McLaren. Excellent. Excellent. Maybe being a teacher or a writer. I love both of those. Well, here's the thing. Being a nurse, you're a teacher. You're a teacher. I like to write. In my youth, I wrote a lot of poetry. I like words. So so even in music, I like a variety of music because it's not, even if the music itself is not great, sometimes the words, the words just tell an amazing story. So good. McLaren's, that's great. Awesome. Glad you came on. Yes, you stick to that and definitely be a nurse. Where's the rest of your buddies? Where's group one? If they miss it, they miss it. So I'll just give another three. So McLaren's. So if I gave my special welcome. I'll do it again. So, and I refer to people as ladies and gentlemen. Especially in the professional world, you really should try to get away from referring to people as guys. I mean, we all do it. We all do it. We all do it. But in a professional sense, you really should try to get away from saying you guys and you guys and you guys. It's kind of a little chatty, personal stuff. So that's why I deliberately start my channel. I mean, of course, we could be cool and friends, but at the end, I want us to be professional. So I started saying, ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. In this video, I'm going to give you some tips on how to study for your first nursing exam. And that's usually how I start every video. I started saying that and it just became so natural. So I start my videos the same way and I have an ending. So if you hang out to the end. So let's see. So let's start. So your first nursing exam is going to be a shock. I could be dishonest, but I'm not. It's going to be a shock, and we want you to do well, because think about that. Prior to coming to nursing school, again, I know what the prerequisites are for our program. The prerequisites in other nursing programs, they're similar. Nursing, medical field, you're going to care for the human being. So you have to have an understanding of the human body. So first and foremost, you are required to take anatomy and physiology. That's why. Sorry, you have to go. Okay, good. Be good. No problem. Good. Excellent. Don't worry about it. That was fun. Let me give you half a heart. Put it. There it is. Come on. Bam. Have a good evening. So we made you do anatomy and physiology because we want you to get a basic understanding of not just where parts are, body parts, organs, but how they work, and primarily how they work together. So that's one of the reasons why. So historically, in the nursing field, students who did well or had a good foundation in anatomy and physiology often do well in nursing. So we don't have to reteach too many things. Now, of course, as an educator, if I'm talking about the respiratory system, I may also talk about the cardiac system because they work together. Heart, lung, machine, fluid in the lungs, fluid in the heart. So we talk about multi-system. It's very seldom as a nurse that you have a client, especially an older client, that only has one problem. They may come in with one main problem, but then they may have what we call these comorbidities. And those comorbidities are things that they've been dealing for a long time. Chronic health conditions may interfere with their health. So we know that. So a good foundation in anatomy and physiology will help you prepare for your nursing exam. Now, you took English, and of course, we're not asking you to write a big paper yet, but at some point you will, because in addition to the nursing part, we want you to be a total graduate of your college, and we want you to be really based in general education, to be able to write a full sentence, whether it's on a pen or paper, digitally. You may be writing a letter, a job request. I'm back for just a second, just to let you know, it'd be awesome if you have a Discord server for your students. Gotcha. Thank you. I like that. I like that. Thank you. That's good. So you, a little bit later, as you progress, finish your associate degree, bachelor's, master's, research, and beyond, you have to be a good writer to be able to communicate. So that's important. You also took math, you need that for medication, and you took the psychology courses, because a human being, it's not just physical, it's the mental, the emotional, psychological, the spiritual, really have a full understanding. But back to your very basic, generic, first fundamental exam. Let's talk about some of the common things that's normally on a fundamental exam. So we're starting from the very beginning. And despite the fact that you might have worked as a nursing assistant, a CNA, a tech, or even a vocational nurse, your first exam acts like you don't know that. You don't have any of that. It may benefit you, but for some of you, it may actually be a detriment, because you've been doing bad things. Now, the exam, you have to try to forget about those cutting corners you did and focus on, this isn't a perfect world, Utopia General Hospital, as I like to call it, and let's begin. So one of the main topics that's usually assessed or tested in your first exam is professional issues. Now, I know some of you have been memorizing. There's so many organizations. You have the ANA, which is important to know what the ANA does. We also have the NLN, the National League of Nursing. There's ODN. I always talk about ODN. That's the Organization for Associate Degree Nursing. So, a fundamental student, you may want to memorize those, as I call them, Jeopardy questions. Okay, fine. You've memorized them. Now what? Now what? I'm a nurse, and let's say I'm a nurse at a hospital. Why would I be thinking about the ANA? Well, you have to think about the ANA. Who says nurses do certain things? Who tells you that the nurse can take a blood pressure? Who tells you that the nurse can give medications? That's how you look at those organizations. So professional issues, not memorize. You don't need to memorize who the first nurse is, second, third nurse. Every culture has their own first nurse. It's more important to understand what those nurses did, how they did it, what barriers, and based on what they did, how did that benefit us, future nurses, benefit you, future nurses, and really most importantly, how do we take what we've learned from them, build on it, make it better to make patient care better? Because ultimately, it's about the individual that seeks care. So I wrote on my thing just a quick question as to one of the things that students may. Here's an example. So this would be considered a memory question. I mean, it's a memory question, and it's good to know. But so, for instance, here's an example. Which of the following organizations sets the standards for infection control? So here's a tip on how to, when you not just study, but to take your exams. I read that question, and before I even look at the choices, try to answer it. So let me repeat. Which of the following organizations sets the standards for infection control? Right away, you hear the word infection control. At minimum, you should know at least one organization's, even if you're like, well, what does set the standards mean? At minimum, you should know in this world, day and age, at least one organization that has some sort of say in infection control. McLaren's, please write down one that's involved in infection control. Before I read the choices, you still here? I'm waiting. I don't know if you're still here. McLaren's, give me a sign that you're still here, if you're able to. Okay, good. Excellent. So the CDC, Centers for Disease Control. So your answer, oh, well, look here. So here are my choices. My choices are A, OSHA. And again, you'd have to know what OSHA stands for, occupational safety hazards. So of course, how disposing of linen, you already did. That's good. That's good. OSHA, CDC, excellent, ANA, and the NLN. So I deliberately made this question this way because usually in nursing questions, when there are four choices, two of them are almost easily to eliminate. Okay, so those two are not right. So ANA and NLN, no. But now you have OSHA and CDC. So this type of question would be a select all that apply because occupational safety has also to do with infection control and the Centers for Disease Control. So that's another way of thinking and working your way through these nursing exams. Usually when you see four choices right away, oh, this one's wrong, that one's wrong, and then you're stuck with two, and then you have to decide. So I usually tell students, when you get to those last two, go back to the stem of the question and read it again, because two of them may be correct, but the stem of the question asked you which one of them is best. Not in this circumstance, because they're both correct, but it could be which one is best. So it's really important when you find yourself stuck and you have two choices and you're not sure, before you guess, it's a 50-50, before you guess, go back to the stem of the question and read it again and see if it doesn't give you a better direction. So that would be one. That's considered, it's usually in your first exam. It's asepsis. It's the very beginning. So that may be on your first exam. Now here's another question I wrote. And again, so McLaren's, I see somebody else came on. So whoever you are, just say hello so I can talk to you. Just give out a shout out. So here's another one. Which of the following, so that was very broad. This one now, which of the following would give guidance on how to discard soiled linen? Now, this might have been from that CNA course that you took. So anybody in that CNA course that you took, did it talk about what agency, organization would give guidance on how to discard linen, soiled linen? Anybody? Good way to be smart. I would go back to the previous questions because the choice might be there again, right? So when in doubt, wait a minute. If I answer the first one, that I know which organization talks about infection control, definitely soiled linen, a human being's body fluids would potentially be infectious to somebody. So again, I don't know if anybody's typing, but I'll just answer that one real quick. So OSHA. So OSHA would be the right. I'm sure the CDC has stuff, but we're occupational safety. The answer to that one would be OSHA. Like I said, I'm sure a student could argue, but the CDC does too. Occupational safety would be the organization that oversees that one. So that would be, those two are actually kind of knowledge You can memorize, and those things are important. You do have to memorize. Okay. No, I would pick OSHA, McLaren's. I would pick OSHA, occupational safety. So like housekeeping, it's OSHA that tells us that when we have soiled, like dressings that's saturated with blood, OSHA guidelines tells us to put that in a red bag. So with soiled linen, cleaning up certain hazardous materials, that would be OSHA. So let's do a little review on OSHA. CDC definitely focuses on infection, but OSHA does a little too. But with occupational safety, if there's a spill, so here's one. Let me just see if I can get, yeah. So let's say there's a spill. It's some liquid on the floor, and you have no idea what it is. A nurse observes some type of liquid on the floor. How best should the nurse proceed? Of course, to me, you want to put some type of a cone or something that nobody spills on it, but housekeeping would have to consult the OSHA guidelines on how to take care of that type of liquid. Of course, most liquid in a hospital, it's probably water, IV fluids, or body fluids, but there could be, let's say it's mercury or something else. So they would have to definitely consult OSHA guidelines on how to take care of such liquids, materials, etc. Now, so those two so far on the levels of learning and testing you, those are knowledge questions. So again, they're good, but we want to build on your knowledge. We want to take you a little bit higher, right? So here's another question I wrote, and I want McLaren to answer this one for me. So think this one through, and thank you so much for being here. This is good. I've tested my live before, and I never really went live, but so I'm happy that everything worked out, and I set it up, and it seems good, and the lighting's okay, and yeah, and somebody showed up. So a nurse is planning the care for two patients. One patient has flu-like symptoms. So I would stop and like, okay, flu-like symptoms. And the other patient has had diarrhea for 2 days. Which would be the best approach when planning care for these patients? So let me read that again, right? A nurse is planning care for two patients. One patient has flu-like symptoms, and the other patient has had diarrhea for 2 days. Which would be the best approach when planning the care for these patients? So now, McLaren, before I even read the choices, you have two patients. One has flu-like symptoms, and the other one has had diarrhea for 2 days. Can you write something that's going through your mind right now about those patients? Anything? Wait for it. Come on, write something. Are you still here, or are you having some trouble? All right, so we're probably having a little bit of delay. So let's let's see. Droplet precautions, excellent. Excellent. I'm glad. It was worth the wait. Thank you. It was worth the wait. So droplet precautions for the flu-like patient. So I definitely want to put that patient droplet precaution, right? I'm going to wear my surgical mask and wash my hands and minimize, right? That definitely. Now for the patient with diarrhea, all it says is diarrhea, and you can't assume. And of course, diarrhea, you should always think in your mind, diarrhea. No, we just had electrolytes, but diarrhea, it could be potentially C. diff. And if it's C. diff, then you want to think that it might be contact precautions, but just diarrhea alone doesn't mean that everybody gets put on contact precautions. But let me just see what I put as the choices here. So again, so the question is, a nurse is planning care for two patients. One patient has flu-like symptoms and the other patient has had diarrhea for 2 days. Which would be the best approach when planning the care for these patients? Here are the choices. A, wear a face mask with both patients. B, place both patients in a private room. I'm trying to make the same face with each one, not to give anything away. C, place both patients on contact precautions. D, place both patients on airborne precautions. Okay, McLarens, it's on you. I'm going to read the choices again. And I think somebody else just came on. Just introduce yourself. Just type something below. I'm going to wear a mask with both patients. I'm going to place both patients in private rooms. I'm going to place both patients on contact precautions, or I'm going to place both patients on airborne precautions. So let me know. Hey, Kimberly, wear mask with both. Okay, hey, Kimberly. Kimberly says wear mask with both. Okay, McLarens. You're warm, Kimberly, warm. Okay. So, I think some McLarens, I know he writes something eventually. So, so Kimberly, so the patient has diarrhea, right? Patient has diarrhea. What type of precaution would you think a patient with diarrhea, let's say it was C. diff, let's just say, what type of precautions would you put that patient on? I like how you spell your name, by the way. It's cute. Contact. Ooh, I'm getting you. Okay. Okay, Kimberly. Excellent. What part of contact has a mask? No mask. Got you. Unless you're gonna kiss it. Right. Okay. So ideally, the best choice out of this would be to put them in a private room. Would put them in a private room. So close. So again, because if you think the patient has contact, exactly. Wear gloves. Yes. Oh yeah. Well. Routine. You're gonna wear gloves. You're gonna wear gloves. You're not touching any body fluids. So flu-like symptoms, you're thinking droplet, right? Diarrhea. When in doubt, they'll treat it like it could be C. diff. So that would be contact. So ideally, you want them to be in a separate room. Now the reality is, which is fine, if you have two patients who both have C. diff, you can put them in the same room. Still contact precautions, but if patients too, you definitely want to put, I don't want to talk about what happens in the real world, but in a perfect world, in Utopia General Hospital, you have two patients, both with C. diff, you can put them in the same room. So that's fine. Ideally, you want them by themselves, separate in isolation rooms. So I'm glad we talked through that one. Here's another question. This one. In which of the following I just sat at my desk and wrote these before I came home. In which of the following patient care situations would it be necessary to wear gloves? And if I were taking this exam, I would underline the word necessary before I even look at anything, because you could wear gloves going to 7-Eleven. You could wear gloves going to Walmart. You could wear gloves going to the gas station. But is it necessary? So before I read the choices, When do you wear gloves? You know what I'm looking for. When do we wear gloves? Because that is the guiding principle in your mind. When do you wear gloves? Come on, Kimberly. Waiting for it, girl. Come on. No answer? When do we wear gloves, McLarens? When do you wear gloves? There you go. Perfect. Perfect. When there's a potential for exposure to body fluids. Excellent. Let me read the choices. So, in which of the following patient care situations would it be necessary to wear gloves? You can only pick one. A, when feeding a patient. There you go. Excellent. Remember that. Remember that. It may sound like I'm preaching it, but if you remember that when it's exposure to body fluids, then you don't have to think about the scenario. Just think about, okay, body fluids. Okay. Body fluids. Okay. Body fluids. So as I'm reading these questions, let's think of any body fluids. When feeding a patient, when giving a back rub, when giving a partial bath, when transferring a patient. You have to pick one of these. We can have a conversation, but out of these four, you have to pick one. When feeding a patient, partial bath. When feeding a patient, when giving a back rub, when giving a partial bath, when transferring a patient. Absolutely. So with these, partial bath is correct. Of course, there's going to be a conversation. Well, if I'm feeding the patient, they may spit. Okay, so if in those instances, then you do. And if you think the patient's going to spit, then you also wear eye protection because that's also standard precautions. But on average, if you're feeding a patient, you're holding the utensil, you're not going to be touching the saliva body fluids. And of course, you're going to wash your hands before and after. Now, if you're going to assist a patient, you're going to put the dentures in their mouth. You betcha. You're going to put on gloves, and hope they don't bite. So excellent. That's how you work through that. So that was where that I got with writing down some questions. So for the two of you that are still here, just the two McLarens and me, in some of those questions that we talk about reading. So some tips on how to study. I tell students all the time, read your text, but there comes a time when you have to close the text. Minimize the screen, close the text, because after a while, all you're doing is reading, which is fine. You're reading and rereading. You have to be able to test yourself what you know. And even if testing yourself for what you know in the beginning is memory, you want to find out how much did I memorize? Because the truth of the matter is, as I said, there's some things that you do have to memorize. So you at some point have to close the text. I tell students, close your text, minimize the screen, pull up a Word document, take out a piece of paper and start to jot down what you know. Not just don't jot down anything. So for instance, we're talking about, let's say you're going to pick asepsis. Asepsis. One of the things I'd write down, okay, use gloves when in contact with body fluids. Then pause and then try to figure what are the body fluids. List the body fluids. So if you said, okay, body fluids is saliva, okay, great. In what patient situation would I potentially be exposed to saliva that I need gloves? If I'm going to put a sublingual medication, I'm going to go below the tongue, definitely use gloves. If I want to inspect the gums, definitely use gums. Patient says, I need you to take a look at this swollen part in the back of my gum, definitely. And again, if you're feeding the patient with a spoon and this, you don't need gloves. So think about that. You're talking about body fluids again, talking about the eyes. When would I potentially may touch their tears, their drainage? If I'm putting in eye drops, right? You talk about urine. The correct answer, McLaren's, on you're giving a partial bath or a complete bath, because a partial bath is the bath that you bathe those places that may get an odor. Armpits, just sweat, perineal area, ground, urine, and feces, definitely use your gloves. So that's how I ask you to look. So then, if you're taking a patient's temperature, you should wear gloves. Whether it's oral or rectal, definitely use gloves because potential for body fluids. So that's kind of how I ask you to close your book, pick a heading, pick a topic, professional issues. Okay, what does professionalism mean in nurse? Okay, behavior, I have to behave a certain way. Who gives me permission to do certain things? Is there something I can do that the nursing assistant can't do? How do I get a license? How do I get an education? What does an RN mean? And what does it, that's all under professionalism, not necessarily the initials, but the scope of your practice. Talk about the legality. What if a nurse deliberately does something wrong? Could a nurse be sent to jail? You betcha. Need to get a good lawyer, but backtrack. Don't do it. You can do things wrong. You can make mistakes unintentionally. You're still responsible for it, but don't do any harm. Don't, take the same pledge that you don't do any harm. So that's one tip to do, to at some point close the book, close your notes, cover them, or look in the mirror and said, okay, what do I know about nursing process? Oh God, I don't remember anything about nursing process. Okay, assessment. What is assessment? Talk to yourself about assessment. You may ask a friend to, not everybody can do study groups or a study with a partner, but, ask me a question about assessment, so you have the idea of the experience of talking about it and saying about it, so those are some of the stuff. Look in the mirror, talk to yourself. It's okay. Just let your family member know I'm doing this, I'm not losing it, right? So that's one thing. Highlighting, reading. When I know students have all different color highlighted, and if it works for you, I'm not here to change your study habits if that has worked for you. So I tell students to, when I say highlight, whether it's in ExamSoft, you can highlight some parts of the test item. So it's important, if you highlight certain things. So I'll give you an example back to one of these questions about what I mean about highlighting. So in the first question, which was a memory knowledge question, I said, which of the following organizations set the standards for infection control? I would highlight infection control. The question is asking you about infection control. Basically, who talks about infection control? So highlight, even in the stem of the question, underline, circle, highlight, to bring you back. When in doubt, go back and says infection control. What does that mean? Right? So highlight that. Case studies. So far I've given you, we had a case study when we talked about labs. Case studies are very good to help you get a scenario. Some of you haven't been to the hospital yet. So a case study are good ways to study. So I deliberately put an average age of the patients that we normally see. So for fundamentals, we're primarily teaching you about the older adult. So most of our case study is going to be somebody older. When you get to cardiac, because heart disease, the highlight of heart disease it can start much younger, but it's usually middle age, with the hormonal level, comorbidities, obesity, overweight. So you're in the age 40s, late 30s, 40s. So when you get to cardiac, your patients more often are going to be younger. And then you also do have some older. The patients who get pneumonia are lifelong smokers, chronic illnesses, elderly, losing the elasticity just about everywhere. And then you'll get that. So case studies are good. Nursing questions, most often ask you to make a decision, I want you to keep in your mind that a nurse always has more than one thing to do. A nurse never just has one thing. A nurse doesn't have one, I mean, unless you're in ICU, seldom, sometimes you may have one patient, but ICU typically have 2 or 3 patients. So a nurse always has more than one thing to do. What you have to decide often when asked in a question and also in reality, in practice, what should the nurse do first? See, students know, oh yeah, the nurse should do this, this. The critical decision making is what should the nurse do first? And you many times will go back to the basics. Airway comes first, based on certain things. A patient is complaining of pain, and the patient's also complaining of an upset stomach. Which one do you address first? Now, I put that as very vague, but it's certain things like that. So it's usually what should the nurse do first, or you get some data. We give you some assessment data. Patients complaining of pain, temperature is 99.4, blood pressure is 130/80. Which of the following data needs an intervention? In order to understand that, you have to have memorized what normal is. So that's why you need to know some of those normal things. So in order to know what's abnormal, you've had to memorize normal. So I'm not going to ask you what's a normal temperature. That's a memory question. You should have memorized what a normal temperature is. We may give you 4 sets of vitals. 3 of them are within normal range, and 1 of them is abnormal. You may be asked, which of the following set of vitals need an intervention? In order to determine that something needs an intervention, you need to know if it's abnormal or not. And we can do that oftentimes with vital signs. So think about priority. What should the nurse do first? Sneeze. What should the nurse do first? The nurse has 2 things to do. The nurse can do both of them. Maybe the CNA can do one of them. The nurse has to determine which one do they delegate to the CNA as part of the team. So in order to know, you'd have to know the scope of practice of the CNA, know your scope of practice and your role, and the professional role of delegating, who to delegate to. Those are some of the key things to look about. Is there something? Yeah. So typically on your first exam, these are some of the topics I wrote down. Professional issues, of course. Asepsis, nursing process, fire safety. I think fire safety was covered. So this is what students memorize. We don't ask that anymore. We shouldn't. The acronym RACE. We know that you know the acronym RACE. Rescue, not run. Rescue, alarm or alert, right? Contain, and then extinguish. So the first key is rescue. So you've memorized what the acronym RACE means. That's memory, foundation. A little bit higher. What do you do if you think there's a fire? Decision making. What do you then do if there's a fire? So let's go through that. We have RACE, rescue, alarm, or alerts. You got to sound the alarm. Contain and confine. So now let's say, for instance, you're at work and you hear the fire alarm. Well, look at this. We heard the fire alarm. So there's a fire alarm. I'm still got to go back to rescue to see, rescue myself, rescue my patient, right? So at any point, you should always be rescuing the patient. HIPAA, patient confidentiality, patient's rights, patient's health information, patient identifiable information. So talk about that. So you've probably memorized that. Health promotion and wellness, prevention. So real quick, and maybe I'll just wrap up on that to give you an idea. There's other stuff. So it's really important in the very beginning, before you go start to fix things, let's try to maintain things in a good way. If something is good and it's not broken, let's maintain it so it doesn't break sooner than the normal, part of life. So we talk about previously prevention, and the first one, primary prevention, is the prevention. Things that you do to help you prevent from getting a disease or certain illnesses. Um, I mentioned about a seatbelt, and I talked about that. So wearing a seatbelt doesn't prevent you from crashing if you go 90 miles an hour on a rainy day, on a curve. You know, what it's going to do is minimize the damage from the airbag or from the crash. So that's why a seatbelt is considered a primary intervention. The next one, secondary, as we talked about, is screening, right? Or detecting. DNA test is going to detect if Tyrone is the daddy, or if Hector or Ira or who else, or Pavinda is the father. Trying to put some more of my culturally diverse Queens individuals in there. So we talked about labs today or yesterday. CBC, it's going to detect what your levels are. A BMP is going to detect your electrolytes, your coags, PT, INR, PTT. It's going to check what your clotting numbers are. So those things are detection. A mammogram, early detection. Self breast exam, self testicular exam. Early detection saves lives. It's really important to do that. And then lastly, under tertiary, the T for treatment. So if a person is going to rehab, they're going to rehab because they had a problem and it was detected. And now it was treated in the hospital, and we're sending them to rehab to continue the treatment. And just be very careful. I always use exercise and as an example. Exercise can be used as prevention. Exercise can help you strengthen your bones. Weight bearing exercises strengthen your bones to minimize you getting brittle osteoporotic bones as you get older. Exercise can also help you lose weight. Keeping a healthy weight can lower your cholesterol, minimize your risk of heart disease. So on the preventative level, exercise on the tertiary treatment level, such as rehab, sport injury, tennis injury, slip and fall, break a knee, go to rehab. So just understand some of these things that there's some medications. There's some medications that are used for primary, such as the vaccination. Vaccination is a medication. It's used to prevent. On the other hand, you have medications, high blood, antihypertensive, insulin, glucose. So look at the concept, look at how. So let me just see if I can think of a question on this one. So which of the following, this is easy. Which of the following are examples of secondary prevention? So I'm not going to give you the choices. I'm going to let you think them over because just in case. Which of the following are examples of secondary prevention? So you should be able to do those. I think that's about all I have. We've been talking for about 45 minutes. I'd like to do this again maybe next Thursday. So let's see, let's shout out to Osha, Fudge that came on, McLaren's, thank you for coming on, Kimberly, and myself. So this worked for me. I appreciate any feedback. So I was, I wanted to make sure. I try not to tie up my phone because I have stuff going on there, but the webcam worked fine. And the mic worked okay. I'm happy about that. Definitely always want to get some lighting. It's just really important to get some good lighting. And I didn't want to wear my channel shirt today because then I would just totally blend into the background. So I just kept on this pink. So anyway, I hope this helped you. And I'll end it how I have. So again, if this is your first time to my channel, welcome. I hope you stay. Have a good day.